Hi, welcome to the Living with Vision Loss podcast. My name is Ciccarone. Today we're going to answer the question, what is low vision? It's such a hard question. How I explain it to my patients and students is low vision is when your acuity can't be corrected to 20/20 with glasses, with contacts, with a surgery, or with any kind of medication. Usually people that I work with that have low vision have an eye disease. My older adults, they have macular degeneration, they might have glaucoma, they might have diabetic retinopathy, they might have macular edema, or my working adults might have genetic conditions, ocular cutaneous albinism, they might have ROP, they might have Stargardt's. So there's a lot of different conditions that cause low vision. So in where I work with a low vision optometrist. Actually, I work with 3 low vision optometrists. A low vision optometrist is a specialized eye doctor that can see if a pair of glasses could help improve your acuity at distance or near. They have specialized lenses and larger charts to see if glasses can help. When you get glasses, you have an eye exam, which is called a refraction. So they're basically seeing if the light can shine on your retina by different kinds of lenses they're trying when they put the lenses in front of your eyes. If you need glasses, your eyeball is probably too short or too long and the light can't get to your retina. So when you have an eye exam or a refraction, the doctor's trying to get the light exactly on your retina with different kinds of lenses. For our patients that have low vision, the light is getting to the retina. It's just the retina's damaged. So a lot of my patients, they want new glasses, and I have to explain that glasses might not help. That's really a hard thing to talk about and discuss. What we do, if glasses can't help, we prescribe devices to help people magnify the print at distance and near to see and read whatever they want to read. It's really a journey that can be exciting. It can be frustrating, but it's really important to go on that journey. And the first aspect of understanding low vision is understanding that usually glasses cannot help improve distance or near acuity. So we answered the question, what is low vision? But what treatment interventions are available if glasses won't help? The treatment interventions that are available are prescribed by the low vision doctor. Once we determine that glasses cannot get you down to 20/20, the low vision doctor is going to prescribe a magnification device for distance, for near, whatever your goals are. So the treatment intervention that we do is when you have low vision and you realize glasses can't help, we get a baseline of what vision you can see. We figure out what your goals are, and then we prescribe devices to achieve that goal. I'm going to give you a real life example. So we've had patients that wanted to see faces on TV better. If they have reduced acuity, we can prescribe a magnification device to make the television bigger. We also could encourage them to get a larger television or sit closer to the TV. So a bigger television is size magnification. Sitting closer to the TV is distance magnification. And then a telescope is optical magnification. Those are 3 different ways we can help a person see the TV better with low vision. An important factor that we find out is where are they sitting from the TV and how big is their TV. Anything with magnification, the factors you have to consider are what size that you need to see and what's the distance you are from the object. Our treatment interventions are not just based on acuity. When people have low vision, they might have reduced acuity, which is print size, or they might have reduced visual field, which is part of their picture is missing, or they might have reduced contrast. So when we talk about low vision, our treatment interventions are always going to consider acuity, visual field, and contrast. And the last thing we consider is glare. When you have eye disease and low vision, you are sensitive to light and you have trouble with glare. I always explain glare as light bouncing in someone's eye, and that can really impact activities, especially on devices or on the television. So for treatment interventions for low vision, if glasses cannot get you to the desired acuity for your goals, we will prescribe devices for acuity. Visual field, we will prescribe techniques, which we'll get into in another episode. Contrast, we can brighten your TV, or for glare, we can try different filters. Just remember, treatment interventions for low vision involve usually acuity, which is size, visual field, which is picture, contrast, which is color, and glare management.